Thanks so much, everyone, for joining us this afternoon. I wanted to start just by gratefully acknowledging that our work at BC Children's and BC Women's Hospital is on the traditional, ancestral, and occupied lands of the Coast Salish people, specifically the Musqueam, Squamish, and Tsleil-Waututh Nations, and we're very grateful for the opportunity to live, work, and learn on these sacred lands. Today, I'm really excited to introduce to you today Alicia Murdoch, who's going to be presenting on the CANTRAIN platform. So Alicia is a certified clinical research professional with ACRP who has over 15 years of clinical research experience. Alicia has worked as a research coordinator, an ethics and regulatory coordinator, and a research ethics board review manager. Those positions have given her experience and a broad knowledge of clinical trials research processes. In Alicia's most recent position as project manager with the CanSolve Chronic Kidney Disease Network, she was involved in the creation of several educational courses and webinars, which really sparked her passion for education. Alicia joined CanTrain in August of 2024 as Partnership Engagement Coordinator based in British Columbia, engaging and supporting research clinicians, trialists, and fellow clinical research professionals to build capacity for clinical trials research in BC. So I will, without further ado, turn things over to Alicia. And just if you have any questions, just a reminder, we are in a webinar format, so to please pop them into the Q&A. Thanks, Alicia. Over
Great.
to you.
Great. Thank you so much for having me and for the introduction. So my name is Alicia Murdoch. I am very well versed in children's and women's as I worked at the Children's and Women's Research Ethics Board for a year as a mat leave replacement, and I worked at
Sorry, Alicia, I'm so sorry to introduce you.
Yeah.
We're seeing your presenter view.
Oh, crap. I don't know. Let's see if
I do this all the time.
I thought I was being so slick and I had it ready to go. Let's try this one more time. Do that. Is that good?
There we go.
Okay.
Perfect. Thank you.
Yeah, so like I said, I'm very excited to be here today presenting to you on CanTrain as I have worked at both my children at Women's Hospital. So I'm very well versed in both of the hospitals and the work of the Research Institute. So I'm excited to be here today on behalf of CanTrain, the training platform. I am the Partnership Engagement Coordinator for CanTrain here in BC, which really just means that I'm put in place to try to communicate to the partners across the province what the opportunities of CanTrain, but as well as try to engage more partners. I am embedded within Health Research BC. Health Research BC was one of the is one of the funding partners and was on the original grant for CanTrain. And so they fund some of they help support the awards and as well as the internships that I'll talk about in a little bit. So CanTrain was part of this major investment that the Innovation, Science and Economic Development Canada strategy put out a few years ago. Coming out of COVID, there was a lot, as all of you will know, of chatter about how Canada kind of lagged behind considering our status as a First World nation in terms of the capacity and the uptake of clinical trials that we had during that time. So the government and this Innovation, Science, Economic Development Canada strategy came out with a call for these research training platforms to ensure that to really grow Canada's clinical trial ecosystem and to really put us up there, not just in terms of getting ready for the next potential pandemic, but also just economically to help make us a force in the clinical trials landscape across the world. Many of you may know about the ACT, which is the Accelerating Clinical Trials Consortium. So through this funding, it was ACT was formed out of that, and there are 7 training platforms that were created. CanTrain is what we call a generalist. We just do clinical trial training regardless of what type of research you're doing. There are 6 others. So one of them is IMPACT, which many of you probably know about or maybe work with. So IMPACT is the maternal maternal and pediatric research platform. There is one called StatCan, which is obviously about statistics and biostatistics and clinical trials. There's one about pragmatic trials, HDRN. There's StrokeCog, which is about stroke research. There's CBITN, the Canadian Behavioral Interventions and Trials Network, which is much like its name suggested, about behavioral interventions trials. And CANTAT Talent, which is also another more generalist one that is training more people in order to be clinical trial team members. So really the mission of CANTRAIN is to develop this clinical trial and clinical research competency through this training platform that we've created, using really adult learning processes and inclusive educational curricula to help the entire, everybody in the ecosystem, including the patient and community partners. So some of the things that set CANTRAIN apart are that it's competency-based, so it's not just reading the book. It's not just reading the text. It's really about using that text, using the modules to reaffirm that information and help you build the skills to use that information in your work. It's scientifically grounded. Like I said, they use adult learning principles. There is a whole team of clinical research educators. These are all people that have education backgrounds, primarily masters. There's a couple PhD, and so they are very well versed in the ways in which to make the content best to help adults learn and retain this information. Patient-centered and inclusive, so we're really trying to include the patient engagement piece within this training. As I mentioned, I worked for Cancer CKD, which is one of the strategy for patient-oriented research networks that was funded about 10 years ago. And so I come with a very strong knowledge of the patient engagement piece. And so I was really excited to see that CANTRAIN is acknowledging that this is the way that research is going, and for them to be able to add in those sorts of pieces of that kind of learning. As well, the real work relevance and evidence. So putting in there examples within the modules of little quizzes, and some of those examples are talking about real world, issues that come up and how people face them, as well as being able to have our mentorship program to, again, try to get some more of that real work evidence to be able to apply that information and that knowledge that you're learning into what you're doing day to day. The cool thing about CANTRAIN, I find, is that there's 4 different streams. So we're not just focusing on the trialists with your PIs, but also there's graduate and postdoctoral trainees. So that's our stream 1. Master's, PhD, and postdocs. Stream 2 is the clinical research professionals. So that ranges everybody from your research assistants to research managers, clinical trial pharmacists, anybody who is working to actually do the clinical trial protocol. Of course, there's still going to be training for the trialists and the methodologists who are leading these trials. And finally, there is a unique stream for the partners. So these are patient and community partners. This is meant to be not just people with lived experience, but also people like science communicators and journalists, to try to get people to understand and to learn about patient participation and patient engagement in clinical research. So in order to create all this content, we didn't come up with it just on our own, which would have been really hard because it's only a 3-year grant. But there's a joint task force in the States led by Brigham and Women's Hospital and Harvard. And they have created this core competency framework for clinical research professionals. And so the 8 domains you see there, underneath all of them, there are also subdomains. And so this is really what the CANTRAIN clinical research educators have used in consultation with people during the grant process, the grant writing process, and early on, talking to research managers and investigators about what sort of education is needed. And so that's how they're using this framework to build out the learning modules for CANTRAIN. And really what we're hoping with CANTRAIN, the goal is to start with a common foundation, and then depending on your needs of not just you as the coordinator or the research manager, but as an institution, the needs of your professionals in order to grow and offer professional development as well to them. I know you can't really see this, but it is on the CANTRAIN website. So what this the foundational learning, we have the regulatory compliance, which is your basic ICH GCP, Health Canada Division 5, and TCPS 2. And then what they also created is that they realized early on that people, especially when you're having 4 different streams, people are going to be coming with various levels of knowledge based on their experience. So they created this common core foundation, and some of these modules, these are all quite short modules, they're 30 to 40 minutes, but a lot of them are on like good documentation practices, data management, monitoring, patient recruitment. So for people who are maybe brand new, they'll want to take all of them. But for some people, maybe they just haven't done a lot of study startup before, and so they'll just want to do that one. So this is really allowing you um, to pick and choose what you need some education on, but also ensuring that when you get to the next level after this, which I'll talk about, is that everybody's coming with the same baseline information and then they just build on it. So this is the image that they came up with, is building the Common Core Foundation, which is currently out and ready for people to go through. Is next you go to your ground floor and you choose your stream. And then from there, there's going to be various levels. And as you go up the levels, it's going to get more detailed. And for the investigators, it's going to be going from being just a site investigator to, so you're doing a trial that somebody else has created and your roles and responsibilities, up to doing a single site trial, so your own investigator initiated. And then at the third level of stream 3 is being a multi-site PI. So the idea here is that everybody starts at the ground floor and then you work your way up, and you gradually get more complex. And you could also pick and choose what pieces you are wanting to learn more about and what do you need in order to help yourself grow. Our stream 1 probably isn't as relevant to this audience today, but just let you know that it is a 16-week cohorted program, so people apply to this. It's really about career exploration. Every week it's a different topic, different theme in terms of like medical devices or being a CRA, and this is to drug development. This is for people who are, nearing the end of their master's or PhD and trying to kind of show them the ways in which clinical research could be a career path for them. You don't have to stick with academia. Stream 2 is probably the most relevant to many of you here today. And so this is going to be what they're hoping to eventually be something like a la carte, but also for you to be able to, if you have a patient coming in to do a procedure, or you have to be doing something, say contracts and budgets, which maybe it's been a while or you have never done them before, being able to do a short 30-minute module to give you that refresher and be able to feel confident moving forward. So many of these programs are being released right now on a rolling basis as they're being completed. So from now until the end of the year, there's going to be quite a lot of content being released. And this is, again, all trying to develop the people and offer career development, but also help people who are currently maybe clinical research coordinators, helping them understand more about quality management, if that's something that they're interested in, data management, ethics and regulatory that maybe they have not been as involved with before. So being able to offer short learning opportunities for people to grow and find new opportunities. Or if you are offered an opportunity to get into quality improvement, then you can take one of these short things so that you kind of have a basic understanding before going into your to the new role. Stream 3, like I mentioned, is for the trialists, and this is again, as they're moving up, each group of modules will be just for early career investigators to learn how to manage and maintain and be a site investigator, then moving on up to being a single site trialist and a multi-site trialist. And stream 4, within stream 4, there's 4 mini streams. So one is about patient participation. So this is really to just help people understand what it means to be in a clinical trial, try to dispel some of that misinformation that has gone on recently that has kind of soured some people to being a part of a clinical trial. Patient partnerships is, to take that next step and become part of a research team and help develop the protocol and the case report forms, and really become an engaged patient on a research team. And then there's more in terms of patient advocacy and leadership. And so that's, again, another step up and another set of often soft skills for people to learn how to be a part of that. One of the other really important pieces that we have in CANTRAIN is our mentorship. Obviously, we don't like all of the learning just to be something that you read or even like click through on the modules. Although the modules are very interactive and they're actually quite fun and a better way of learning, I feel, than just reading through like ICH guidelines. But mentorship is also another really important piece of that, because you're learning from people and you're speaking with people who have a lot of experience in the things that you are doing or maybe in the things that you want to do. So right now, the mentorship is really more of a one-on-one or a small group mentorship with the awardees that we have every year. But it's currently being built out to be able to be offered to more people. The peer monitoring is a really great example of that. I'm trying to recruit some like research managers to try to mentor other new people who are coming into those roles and take those leadership type of roles. Also, team monitoring and try and do based on more like community of practices where you would have one leader to share their ideas and their thoughts and their support on a specific topic. So this is something that we are currently building out, and obviously we're always looking for more mentors. So if you are interested, you can go to the website, which is wecantrain.ca for more information about that. So our awards, we do them in partnership with a couple of the other clinical trial training platforms. This is just some stats from some of the people that from the last couple of years, we've given away around $2 million. A really great thing that I'm always excited about is from BC. I think there was 46 of the studentships from CANTRAIN. I think 20 of them were from BC. And so that just shows the quality of work that's coming out of our institutions. So that's something I think we can be really proud of. Another piece is the internships. So right now, the internships are open just for the clinical research professionals right now. So you can go to our website to learn more about that if you're interested. It's funded through Health Research BC. And these are a really great opportunity to be able to get some funds so that you can go somewhere. So say you want to go to Sick Kids because somebody you've worked with, you want to like shadow their lab. So you can go there for, a week maybe or a month, depending on the length that you and the people that you want to go to decide on. But when you're there, it just offers that money to be able to pay for your flights and your food and your lodging, so that that's not a barrier for you to learn from new people. They're hoping to working with MyTax to do placements, industry placements for graduates and postdoctoral fellows, working with Immigration Canada to try to create a placements for London immigrants, because as we know, there's many people coming from around the world who have experience from other countries, but it's really hard to break into the industry when you don't have experience from within our healthcare system. And finally, one of the other ones they're working on right now is internship for patient and community partners. And this is really to help people who are in advocacy roles or who are engaged in research learn about more about what it takes to be, what happens in the group, and what it takes to be a part of this and to engage with researchers. So that's what I wanted to say about CANTRAIN. Because Children's and Women's is part of PHSA, you are all eligible to um, apply for the internships and the salary awards, and you can all go on and log in today to access the modules as well. I will just land on this one last thing. Like I said, I sit with the Clinical Trials BC group. And so they've been so helpful in not only getting the word out about everything that's going on in CANTRAIN, but I also want to say that they have a great suite of um, learning opportunities. Like the next access is about equipment and calibration with Karen McGilvery from BC Cancer. And then there's a Get Certified session June 26th. And this one's actually one I'm going to be a part of because I actually benefited from this. I did my CRP certification about 5 years ago, and I did the training program ahead of time, and it was also paid for by Clinical Trials BC. So wanted to give a shout out to them and let you know about those events. And there's also so many more resources if you don't already know about them on the Clinical Trials BC website. That's all I had to say. We are on LinkedIn and Blue Sky, so you can check us out there. You can also go to our website and sign up for our newsletters just to learn about what's happening within CANTRAIN and being able to connect with us more.
Great. Thank you so much, Alicia, for that overview. We do have some time left. It's 12:26, so does anyone have any questions? Feel free to drop it in the Q&A. I don't see anything in the chat yet.
I will say that within CANTRAIN, with all the modules that we're creating, the group is continually trying to make content. So we are a 3-year grant, but there are plans in case there isn't another call. They're working on a business model in order to keep CANTRAIN moving forward and allowing these educational opportunities to be available. One of the things is that if you notice there's something on there that you think is missing and that would make a really good, important module, please reach out and let us know. The clinical research educators are always looking for things that we can do to help support the research community. I know that a lot of times the pediatrics and I would say maternal, but women's research in general is often something that sometimes is not as public facing. As a woman myself and someone who had children, I fully understand the limitations that clinical research currently has on those things. So if there's things that you think that could be are better suited or that need to be brought up or gaps in the learning, we would love to hear about it and work with you to create a module on that topic.
We have some questions. So Larissa is asking, is it possible to apply for internships staying in the same city and province, and how to find a reference group for those who are starting in the clinical trials field?
Yes, it would be definitely possible for you to stay in the same city province. Absolutely. You don't have to travel, but they just are making sure, just want to make sure everybody knew that if you wanted to travel, you'd be able to be supported to pay for that travel. How to find a reference group for those who are starting in clinical trial field. I think that this is something we're talking about right now in CANTRAIN is how to find people who are want to learn together and people to lead them. So I currently don't have a reference group for that, but I would sign up for a newsletter so you could keep up to date about what's happening. And also I would say that one of my best things, I know that many of you here probably already know, is the CRPBC, Clinical Research Professionals of BC. They're a great resource, and I met many people when they used to do them in person. I've met many people that way.
Amazing. Thanks, Alicia. There's a couple more questions in the Q&A. So someone has asked, is there any cost associated with the program?
No, there's absolutely no cost. It's free to everyone. I mean, we're a grant funded agency, so that's why. So the money that the government has given us is what we're using. It's all free right now, for anybody who is a member partner, and PHSA is. So yeah, you can go ahead and sign in and start looking at the courses right away.
Great. Thanks, Alicia. And feel free to reach out to the CRSU if you have any questions about getting access to CANTRAIN through BC Children's or BC Women's. And Hina has a question. Hi, Hina. Thank you for the helpful information. She says, for satellite sites, would there be an option to have a module to train staff in those sites who may not need as much detail?
We don't have a way in which to, like train the trainers right now, but that's a really interesting thing, interesting idea to have. One of the ideas with it being online is that we're hoping that it is more accessible to people and who are in the more remote and rural areas and sites, but we don't have that program right now.
Any other questions for Alicia? We'll have her.
I will just give a shout out to Clinical Trials BC. If you want more information, you can also reach out to me, Alicia.Murdoch at We Can Train. I can put that in the chat, but and check out the website for more information. And then of course you can reach out through the website if you have a specific question. We also have the like mentorship list on there and lots of links to different opportunities across our other CTTPs, other training platforms. So if you have a specific question for them, we also share a lot of the modules and things that other people have. So we're trying to be a hub for anybody who wants to learn about clinical trials and being part of a clinical trial. We're trying to be a hub to be able to, if we don't have it, at least we know somebody else who may have that information you want and be able to send you to them. So
Amazing. Thanks, Alicia. I guess also a quick question, if the staff are working through the CANTRAIN modules and they have a question about the content, is that something that they could reach out to you about, or is there a different email or contact that
no,
they
they
should
can
be reaching?
definitely email me, but there's also when you enter into the modules, you'll see on the side that there is the content creators and mentors for each module. So you can
Perfect.
reach out to them specifically if you have a content question, because they are the ones that worked on the content, and so they would probably be better able to answer those questions. But of course, you can reach out to me as well. That's what I am. Not I'm the BC representative here, and so I can quickly be able to get that question to the person who needs it, who can answer it for you.
Okay, that's great. Wonderful.
Okay.
Okay, if there's no further questions, I hope everyone enjoys the next 30 minutes of their lunch hour. And thank you so much, Alicia, for joining us. Really appreciate your time.
Thank you so much for letting me come and talk about this.
Absolutely. And just a flag for everyone, we are having a June research, Children's Women's Research Lunch and Learn, and it's on the clinical trials ecosystem. So please join us in June. That's June 18th from 12 to 1, also a Wednesday. Have a great rest of your day, everyone.
Thanks so much, everyone.